There is now officially a cluster of community transmission in New Zealand with 13 new COVID cases confirmed today. They are all close contacts of the 4 cases identified on Tuesday, and all are in Auckland. One is a student at Mount Albert Grammar. 3 are employees at Americold, the workplace of one of the original cases. Another 7 cases are family members of these employees. Another is an employee at Finance Now, the workplace of one of the original cases. This person was admitted to North Shore Hospital overnight but has since been discharged. And they have also infected a member of their family. There is also one probable case of Covid-19 in the community, also linked to the new outbreak. The Prime Minister Jacinda Ardern says the nature of clusters is they grow before they slow. And she's preparing people for case numbers to continue to rise. Here's political reporter Yvette McCullough with a wrap-up of today's updates.
Ms Ardern says the resurgence plan is being carried out in an urgent but calm and methodical way. Yesterday, more than 10,000 swabs were taken and 6,006 tests were processed.
At this stage, heartening to see them in one cluster. But once again, we are reminded of how tricky this virus is and how easily it can spread.
Director General of Health Dr Ashley Bloomfield outlined more details of the travel movements of 2 of the initial 4 cases today. As well as travelling to Rotorua, they went on a day trip to Taupo and went on a boat tour. Dr Bloomfield says one of the 13 new cases also recently travelled to Waikato to visit a relative in an aged care home. He says all staff and residents are now being tested and anyone who has recently visited the home will be notified.
I must say that the visit was when the person was not displaying any symptoms, but they did develop symptoms the next day. I know at least one person who has been tested already has returned a negative test there.
Dr Bloomfield has also made the call that community cases will have to see out their isolation in managed quarantine facilities.
These facilities are expressly set up to help minimise any risk of further infection in the community. Since we have them there, we felt it was best for not just those who test positive and their families, but for the community to actually really strengthen our response.
While there is more information on the cases and their contacts, it's still no clearer how the virus got back into the community. Sequencing of the genome has found no exact link to any recent cases in MIQ. However, not all of the swabs of recent cases were able to be sequenced.
But what we do know is that the genome sequence of the new cases broadly most closely resembles the pattern from the UK and Australia.
Despite known cases travelling outside of Auckland, Dr Bloomfield doesn't see the need to impose tougher restrictions across the country at this stage.
Over 95% of cases occur in workplaces and in households, not through casual visits. But at this point in time, it seems very clear the locus of the outbreak is in Auckland.
But Ms Ardern is refusing to speculate on what this could all mean for lockdown restrictions beyond Friday evening.
I do want the Director General to have the time to give us considered advice and information. And again, what we see within the cluster will be critical, as well as what we might see, if anything, outside of that.
Cabinet will meet tomorrow to discuss the next steps. Dr Bloomfield will hold the usual 1 o'clock briefing on his own tomorrow, and it will be later in the afternoon that the Prime Minister fronts with a decision on whether or not Aucklanders face a lengthy lockdown. From Parliament for Checkpoint, Yvette McCullough.